COVID-19 press briefing. With us today, we have Nita Ludwig, Administrator with the Rock Island County Health Department, and Amy Thorson, Interim Director with the Scott County Health Department. We've also invited Dr. Louis Katz, Medical Director of the Scott County Health Department, to talk with us today about cases of COVID-19 here in the community. Let's go ahead and start with some case counts for today. We'll start with Nita and then we'll have Amy go. Thank you.
Hi, this is Nita. I'm sorry I'm on the phone only today. We're having some internet issues. For Rock Island County today, we have 12 new cases of COVID-19, and that brings our total now to 13,055 cases. We do have 17 people currently hospitalized in Rock Island County with COVID-19, and no deaths to report today. Our death total does remain at 305 for the county.
In Scott County, we've had 18,538 positive tests for COVID-19, and our death count remains at 215.
Okay, Nita, please go ahead with today's prepared information.
Thank you. A year ago today, the WHO declared the coronavirus outbreak as a global pandemic. Those of us in public health have felt every one of those days in the past year, and we understand that you have too. Now we are all gaining access to vaccines that will bring this horrible era to a close. We are so happy to see the number of vaccinations growing quickly in Rock Island County. Our 7-day rolling average is 1,267 doses per day. The National Guard Assisted Clinic in Milan is boosting this effort. But we also can attribute this growing vaccine supply to our healthcare and pharmacy partners as well. Almost 38,000 people have received at least one dose here in Rock Island County, and more than 14,000 have been fully vaccinated. This vaccination process has seen some bumps. This week, we transitioned to a 6-day-a-week National Guard site at the Camden Center in Milan, and we held our last, for right now anyway, mass vaccination clinic run only with health department personnel, Moline and Rock Island firefighters, and of course our dedicated Medical Reserve Corps volunteers. Moving to the National Guard site has meant we transitioned to a new vaccine registration system. Changing procedures in the middle of a response isn't ideal, but it is required when we are using these state resources. We are working to get registration links available earlier, but we have to wait for the vendor to approve our clinic link request. This is taking a little longer than we had hoped. We must ask that you pay close attention to our Facebook page and our website to see when new links are available. We all want a set schedule to post, and we will continue to strive for that. But until then, please check those sites frequently, and we will post links as soon as they become available. One of the biggest changes with the system is the need to put in a voucher code. These voucher codes will be shared on the same Facebook and website post as the link for that particular clinic. You must have a confirmed appointment and a QR code that has been printed out or is available on your phone. This new system is capable of scheduling a second dose before leaving the clinic. However, there is currently a glitch with the vaccine management and scheduling system that the Illinois Department of Public Health and the system vendor are working to fix. This is a temporary problem. When it is fixed, you will be able to schedule that second dose appointment before you leave. We will work out a solution for people who need that second dose, but this probably will require you to schedule a second dose on the system with a dedicated link. We have put aside some reserved hours for the link request for next week, so please look for that as well. Anyone who needs a second dose should click on that second dose box. You will still need the voucher code. Both the link and the voucher code will be on the same posting on Facebook and our website, richd.org. We also don't have control over which vaccine the state sends us. So as you've heard many times from Dr. Katz, the best vaccine to take is the one that's available to you. For second doses, we ask that you pay close attention to what vaccine will be available at the clinic, and we intend to post that every day. So far, it has mostly been Moderna, but there are some days that are going to be Pfizer. So please pay attention to those postings. Finally, we reported Wednesday that we are starting to see a troubling trend of more people becoming infected. Both cases and hospitalizations are rising. We know there are more contagious variants circling in our community, but we also know that masking, social distancing, frequent hand washing, and staying home if you're sick will keep others from getting ill. We have all worked so hard to keep the number of infections low. We cannot let up now. Thank you very much.
As we have come to the 1-year mark of the COVID-19 pandemic entering our daily thoughts and activities, we look back at hundreds of things that have changed in how we interact on a daily basis. The experiences of the last year have been life-changing. From the first case of COVID-19 in a Scott County resident on March 21st to the tsunami of cases in November, our community has experienced more challenges, barriers, and frustrations than we ever could have imagined. Then, COVID-19 vaccines became authorized and truly changed the future of this pandemic. We too are cautiously optimistic as we see light at the end of the tunnel due to a more steady supply of vaccine making its way into our community. To date, more than 49,000 doses of COVID-19 vaccine have been given by providers in Scott County. 14,676 Scott County residents have been fully vaccinated, with more people getting their second dose each day. This is a great sign for our community. Vaccination is a crucial tool in helping us make our way out of this pandemic. We are so close to the end, but we can't let up now. Masks continue to be a vital tool in making it over the finish line. The only time masks don't need to be worn outside of the immediate household setting is when fully vaccinated people are gathering with other fully vaccinated people or people at very low risk of COVID-19. We still need to wear masks when we go to the grocery store, when we attend an indoor sporting event, or when riding public transportation, just to name a few examples. Now is not the time to be hosting parties of individuals from multiple households. Variants of COVID-19 are circulating and put at risk the low case counts we currently have. Vaccine and masks are our best defense against these variants. Do we hope we can attend events, grocery shop, and just hop in the car for an adventure in the near future without worrying about a mask? Yes, of course, but we aren't quite there yet. Both of our counties continue to monitor positive COVID-19 case data. We have come a long way from the dangerous November, where cases were coming in at more than 300 per day, and the hospitals were overwhelmed with patients, and there were many, many deaths. We have experienced a welcome downward trend in cases, but this trend is very vulnerable to the decisions that we make as a community and how we continue our mitigation measures. We have asked Dr. Louis Katz, Medical Director of the Scott County Health Department, to address what he is noticing for trends in our recent daily positive cases. Dr. Katz?
Thanks. Can you hear me?
We can.
You can. Good. Well, here's the 14-day moving average since the first of the year. And I want you to pay attention to the far right-hand side. We're creeping up. This doesn't look like a big change, but it's extremely worrisome given rapid increases nationally and regionally in the circulation of variant viruses, most particularly what's called the UK variant, which is probably 50% more transmissible than what we call wild type that we've been dealing with since spring and summer. And early data that's becoming a little bit more easy to believe also suggests it may increase the case fatality rate by as much as 50%. So any consideration that it's time to back off on non-pharmaceutical interventions, most importantly, masking, staying home when you're ill, maintaining 6 feet of distance, and avoiding indoor venues with crowds. Any suggestion that it's time to back off, any rescission of mandates at the governmental level is inappropriate at this time and risks a fourth wave, possibly with viral variants that are more dangerous than what we've experienced so far. That's about as straightforward as I can be with the data. We are very optimistic, but our optimism will disappear quickly if people back off on the non-pharmaceutical interventions while we ramp vaccines. That's really all I want to say, and I'm certainly available for questions. Yeah, this is Scott County only.
Dr. Katz, there's a question here. What do you believe is the cause of the recent uptick in cases? I know you tend to focus mostly on Scott County. I know you keep an eye on Rock Island County as well, but we'll have you answer that, and then we can have Nita jump in as well.
Well, my best guess is a combination of two things. One is people backing off on non-pharmaceutical interventions. And the other is we know that the UK variant is circulating and it is 50% more infectious and probably 50% more lethal based on the best data that I can pull so far. So I'm sure it's a combination of things. I think it's important to understand that the more COVID there is, the more chance that variants of concern will emerge. This increases the probability that it will be variants that are more dangerous or that can evade vaccine protection. Recent government rescissions of mandates for non-pharmaceutical interventions, as you've seen, for example, in Texas, Mississippi, and elsewhere, especially masks and distancing requirements, may be driving some of this. The population needs to proceed with extreme caution in the short and medium terms, I think, to avoid a fourth wave and to shorten the interval to a safe full reopening in the longer term. There is a light at the end of the tunnel right now. But if we don't double down on the NPIs, the non-pharmaceutical interventions, that light's going to turn out to be a train coming at us.
Nita, did you want to add anything to that, or did that sum that up pretty well?
I got my video to work, but yes, I believe all of the same things are happening in Rock Island County that are happening in Scott County. And our numbers have been kind of up and down the last few days. So we want to make sure we really monitor that and stay on the non-pharmaceutical interventions of masking, social distancing, and hand washing.
We do have a question here, Nita, for you. Could you go over the decision to cancel COVID-19 testing in Rock Island County this month? I think that was recently reported.
Sure. That just came out from the Illinois Department of Public Health this afternoon, or this morning maybe. It was really just a matter of the testing has been lower in Rock Island County the last few times the test site has been here. So they have just reallocated those resources to other counties for now. It is temporary, and I do believe if we need the testing site back in Rock Island County, we can request it again in the future.
Okay, I don't see any additional questions at this point, so we'll go ahead and conclude for today. We'll continue to cover these testing numbers in the upcoming days as they're being monitored by both health departments, so please be watching for that. And we will go ahead and put the recording of this briefing out and as well on our social media and websites. There was a follow-up question to that for you, Nita. Do you have an estimate as to how many people were tested each day in Rock Island County?
This last month, I believe the numbers were under 100 per day. And in our peak time in November and December, they were up over 400 a day. So it had significantly dropped off.
Thanks for grabbing that last one. Okay, thank you everyone again for your time. Thank you, Dr. Katz, again for joining us. We're grateful and we look forward to talking with you all again.